Bismillahirrahmanirrahim. Assalamu alaikum. A 14-year-old boy is brought to the emergency department due to knee pain that began after a trip and fell on a wrestling mat earlier in the day. He has no history of joint pain and is otherwise healthy. Vital signs are appropriate for age. Provocative testing for a tear of menisci or cruciate ligament is negative. Several fixed hard lesions are palpated above and below the knee joint. X-ray of the knee is shown below. The cortex of the lesion are noted to be contiguous with the cortex of the surrounding bone. Which of the following is the most likely explanation for this patient radiographic finding? So this is a 14-year-old boy. He is brought to the emergency department due to knee pain that began after a fall on a wrestling mat. On examination, there is several fixed hard lesions which are palpated above and below the knee joint. Cortex of the lesion are noted to be contiguous with the cortex of the surrounding bone. So they are asking that what is the diagnosis of this question, the most likely explanation of this patient radiographic finding. So as we see here that this is an X-ray of this patient, and based on these hint and the X-ray finding on this patient, the diagnosis of this question is osteochondroma, which is a benign bone. So here the correct option is choice D, osteochondroma. So an osteochondroma is a benign osseous spur with a cartilaginous cap, often palpable on examination. Multiple lesions typically represent a hereditary condition. X-ray confirmed the diagnosis by revealing a metaphyseal exostosis projecting away from the joint and a cortex contiguous with surrounding bone. Osteochondroma stop growing once patient reach skeletal maturity and have a very low risk of complication. They are typically managed with observation only. I will show the photo of the multiple osteochondroma. So as we see here, as I highlighted in the blue, on the blue color, which show that there is exostosis. Exostosis is bone outgrowth, which involve the metaphysis of the bone and pointing away from the joint, which is a specific sign for multiple osteochondroma. Come to the incorrect one. Choice A, bone metastasis. So metastasis demonstrate irregular bone destruction and sclerosis and systemic sign, for example, fever, which are typically present. Choice B, dystrophic calcinosis cuteus. So dystrophic calcinosis cuteus is the deposition of calcium, insoluble calcium, and subcutaneous tissue, which can present as a firm palpable nodule, and it is often seen in patients with autoimmune connective tissue disorder, for example systemic sclerosis. Come to the choice C and E. Choice C, I will explain choice C and E together. Ewing's sarcoma and osteosarcoma. So Ewing's sarcoma and osteosarcoma are the two most common primary bone malignancy in adolescent. X-ray in Ewing sarcoma will demonstrate a lytic lesion with a multi-layer periosseal reaction, where X-ray in osteosarcoma will reveal an ill-defined lesion with an aggressive periosteal reaction, for example, sunburst Codman triangle. Thank you.